This is what we think of Singapore, but we need to consider the actors who built this beautiful city from its humble beginnings. We are here to showcase the migrant workers who contribute to Singapore's beautiful cityscape and culture. In the wake of COVID-19, it unveils the structural inequities that hinder healthcare access due to inaccessibility, exploitation, and exclusion. We are MyWrightNeeds. Our organization advocates for the migrant workers who are the rights that contribute to Singapore's construction industry. Before we examine the disparities of migrant workers, we will go over Singapore's demographics, healthcare system, and labor laws. According to the Ministry of Foreign Affairs, Singapore is a tropical island country and city-state in Southeast Asia. It has a population of 5.64 million people inhabited by 4 major communities. Non-residents, which includes migrant workers, comprise 1.56 million of the total population. Because Singapore is a multicultural society, it has 4 official languages and many practicing religions. Singapore has a universal healthcare system that emphasizes personal responsibility and active government intervention to ensure accessibility and affordability through subsidies. Singapore has a healthcare financial framework known as the 3 M's, which are MediShield Life, MediSave, and MediFund. Despite Singapore's momentous progress in legislation protection, it is not enough. Migrant workers are excluded from Singapore's primary labor law. They experience unregulated working hours and paid low wages. Migrant workers are tied to a single employer, often without a written contract, restricting job mobility while under the constant threat of termination. Migrant workers cannot expect the same healthcare benefits as Singaporean citizens, as their medical insurance is provided by their employers through private insurance, which is separate from the UHC. Thus, they do not receive subsidized care. As a consequence, migrant workers develop chronic diseases and lack data on sexual health and infections. NGOs like HealthServe witness the increasing burden of chronic diseases, and many of them are at risk of occupational-related and infectious diseases due to poor housing conditions and other related factors. Due to these factors, migrant workers are disproportionately affected by mental illness. This leads us to proposing an intervention that focuses on improving legal and health literacy and accessibility, bridging migrant workers, NGOs, and healthcare providers to mitigate these barriers.
Our proposal comprises of strategies that aim to improve the well-being of migrant workers, specifically by adopting the 3 A's: availability, accessibility, and acceptability of free healthcare. We will target a historically known district with a large migrant population called Geylang. The stigma of the red light district among the locals and the poor conditions of old shop houses allows owners to rent them out to low-wage migrant workers. We believe that Geylang is an ideal starting area to connect with migrant workers and to introduce them to free health services because they are vulnerable to abuse and poor living conditions, and because the population is underreported, hence the lack of accurate data regarding NCDs and mental health illnesses. Afterwards, if successful, the interventions can then be implemented to cities and then the entire country. First, we plan to increase the availability of doctors dedicated to serving migrant workers in collaboration with HealthServe, a community organization that offers medical, dental, mental health, and counseling services. We plan to host large group workshops and individual counseling sessions to emphasize physical and mental well-being with native-speaking qualified counselors. Another objective of this partnership includes directing mental health resources to migrant workers, highlighting the stigma involving discriminatory attitudes about mental illness. Next, we propose bringing legal aid teams to provide education on healthcare access and rights as a migrant worker. Instead of directly hiring lawyers, we will be partnering with Lawyers Without Borders to have volunteering lawyers form a legal aid team to assist migrant workers in understanding the guidelines about healthcare coverage eligibility, migrant worker law protection, and rights. We also plan to have the team host educational seminars to train healthcare workers to maximize their understanding of migrant workers and their needs, allowing them to deliver culturally sensitive care, which is an important aspect of our intervention. All of these services will be delivered directly to migrant workers' dorms and housing facilities once a month to ensure optimal needs assessment and counseling. We decided to focus on 3 migrant workers concentrated areas, which are Choa Tukang, the Westlight Accommodation, and S11 Dormitory at Punggol. We plan to establish several free legal aid consultations at religious centers and places, as one has been established in the mosque in Little India. This will be an impactful step in supporting at-risk workers. Finally, we plan to develop a legal aid and health education mobile apps called MyWrightNeeds, which will offer legal aid services and information to healthcare facilities and services for migrant workers. According to an NIH-funded study, mobile health apps could improve patient experience and other positive health outcomes. thus, we plan to adopt the availability of mobile applications to smartphones to disseminate healthcare information. We expect this plan will be effective with minimal barriers as 92% of people in Singapore are smartphone users. Otherwise, we plan to mobilize smartphones and ensure it has the minimum specifications to run necessary apps by partnering with Bridge the Digital Divide to promote smartphone donations and execute a cell phone donation drive for migrant workers who cannot afford or do not have a smartphone.
This is the social ecological theory that inspires the 3 A's as it focuses on the social determinants of health. Phase 1 focuses on establishment of consultations at dorms and religious centers. Phase 2 begins with launching mobile app, transit funding, and training. Phase 3 is survey evaluation, and lastly, evaluations for future education and programs in Phase 4.
Next is accessibility. Accessibility centers how to make healthcare more accessible for migrant workers. Our team acknowledges that while many services may be newly established for migrant workers, they might not be able to access them freely or comfortably. The COVID-19 pandemic brought more attention to the structural problems faced by thousands of migrant workers in Singapore, like poor working conditions and overcrowded dormitories. A major concern for migrant worker health was the language barrier. To introduce a translator service, we are seeking volunteers from Translators Without Borders to be stationed at HealthServe's community clinic in Geylang. Within our app, we are incorporating a hotline to an interpreter service for patients and families with limited English proficiency, called Language Line for Telehealth. This hotline will be available as an optional service during clinical consultations. This long-term goal is to standardize a language line in routine healthcare visits. Additionally, transportation costs can be a concern when accessing healthcare services. Thus, we plan to make transportation accessible for referrals to specialists or emergency care at HealthServe Community Clinic in Geylang. In 2021, a Singaporean local startup offers minibus services to employers to allow their migrant workers to travel safely and conveniently at a manageable price. We plan to push for more accessible rides and work with the organization to maximize safe travel and limit a travel-related injury for migrant workers. Lastly, our intervention will also focus on another significant aspect, acceptability. We consider the different ethnicities and backgrounds of the migrant workers and will collaborate with a local organization called Citizen Adventures, which teaches Singaporean citizens about the lives of migrant workers. Their mission aligns with our purpose of reforming the lives of migrant workers who are part of the community. By gaining a better understanding of the challenges and contributions of migrant workers, locals are more likely to support initiatives aimed at improving their healthcare access. These collaborations will provide an opportunity to engage citizens with migrant workers and vice versa, promoting mutual respect in hopes to bridge the gap between the two groups. Finally, for 1 year, we plan to execute sensitivity training workshops once a month at the hospital to inform healthcare providers the importance of migrant health. The workshop will explore disproportionate healthcare, infectious disease, health promotion, mental health, and health advocacy. It is important to teach future professionals in the field community awareness to build the level of care.
Based on the workshop's effectiveness, we aim to establish a migrant health curriculum standard. Transitioning from online into medical education will enhance community learning and compassion via school courses, starting at the Duke NUS Medical School, and clinical rotations at the HealthServe's community clinics in Geylang. Future implications involve public support of our program's legal aid services for migrant workers. This is critical to expand Singapore's status as a global powerhouse and advocate for human rights within the Singaporean government. As MyWrightNeeds gains migrant worker popularity, health partner integration, and federal support, we aim for national expansion for incoming migrants through local leaders. Based on our projected timeline, our budget is approximately $183,000 with a contingency fund of about $11,000, broken into our administration, our legal aid and health fairs, which cultivate safe spaces and provide educational materials, as well as our MyWrightNeeds application for development and maintenance, and our medical education program with existing migrant worker healthcare leaders for the online curriculum. We are capable of establishing migrant workers as integral, acknowledged, and supported members of Singaporean society. We know that MyWrightNeeds has the capacity to be supportive and sustainable to vulnerable migrant populations today, tomorrow, and beyond.